The National Institutes of Health has really been kind of a central piece in our country, supported by the government for really trying to advance human health and battle disease. And it really has been the major health institute for the United States. Now, in the early 70s, President Nixon declared the war on cancer, had the National Cancer Act, which then created the National Cancer Institute. Now, one of the first things that the National Cancer Institute did was create the National Cancer Center program to create NCI-designated cancer centers. And the vision was that these centers would be centers of excellence for cancer research, but also advancing cancer care and cancer education, and that they would be geographically based as a network really across the United States to have a direct impact and decrease the burden of cancer. The NCI Cancer Centers, it has been clearly shown, provide the very best cancer care in the United States, and that a patient's likelihood of having better outcomes with their cancer care is greater. More accurate diagnoses, earlier access to cutting-edge therapies, better supportive and survivorship care, better dealing with complications if they arise, as well as access to clinical trials can be new therapies, new diagnostic technologies, new ways to help individuals to overcome their care. Clearly, these are really the beacons of excellence in terms of cancer care across the United States. And really, part of that is really bolstered by the tremendous amount of research. That research can be better ways to find cancer earlier. Can we detect cancer in the bloodstream? Are we better off putting CAT scans in minivans and putting them around the country to screen for lung cancer, something we've been very actively involved in? Can we catch lung cancer earlier in people that aren't going to travel? So that's a spirit of innovation, in that everything that we do, we question it every day. Can we do it better? Can we learn from that? Can we share that with others? And we know that there are significant health disparities. Health disparities can be based on resources. It can be based on insurance. It can be language. It can be cultural. It can be financial. It can be transportation or distance or really health literacy. Trying to overcome health disparities is an all-hands-on-deck effort that really looks at this from a 360-degree perspective, from trying to catch cancer earlier, have equal access to life-saving cures, access to clinical trials, and access to that support. We realize there are many barriers to overcome. Advocate Health is developing a National Center for Health Equity, and we're really proud to be a very active part of that. We have multiple different programs, from our Community Outreach and Engagement Program, led by a national leader, Dr. Nadine Barrett, to every aspect of the care here to try to decrease cancer health inequities in every way that we can. This is such an important milestone, not because it sounds neat or from a competition standpoint, but think about the 50 years of impact that this center has had on decreasing the burden of cancer, not only in this community, but really around the world. Whether it be our Gamma Knife program, celebrating 25 years this year, making a transformational difference in brain tumors, or advances in clinical trials through our NCORE research base, our network of clinical trials across the United States that have been based here in Winston-Salem, or our world-class supportive care program, both in research and that being provided, the ultimate truly inpatient-centeredness, the cancer survivors that have come here for their stem cell transplant or for their chemotherapy or radiation. People say, boy, are you competing with other cancer centers? Where do we rank? Cancer is not a competition. Our other NCI cancer centers and our other systems that battle cancer, we are all brothers and sisters in arms fighting cancer. And I know together we will change cancer as we know it.